level. Going up.
Thank you.
Going down.
Oh, we're right here. Why don't you leave Noah with me and you guys go in and take a look and see what you think. Take a peek. You need to go. You stay with me for a minute. You can go right in here and turn to the right. You go forward.
There's my mom, there's my mom, there's my mom. Sleep with Noah. Doctor thought it would probably be best, but just...
I want some too, but we'll decide.
I love you so much. I love you so much. You're so beautiful.
It's a movie star every time. What a dancer. Such a good dancer.
Why does she have a cut right here? Did she fall in her head? That's what it looks like to me.
Yeah, she might have fell. She was at the Uncle King's there.
I love you. Oh, I love you so much.
She might have fell and hit her head when she fell. But they found, Chris found her. She was packing her suitcase to come home. She was laying on the floor face down. I think that's probably what happened to that little scratch up there. I asked the doctor if it was okay if we talked to her, and she says, I talk to him all the time. What they said was, if we...
Look at this big bump on her head, my sweet baby.
Yeah.
I just need to be taken care of properly. Look at those dry clock he used to care. you so much. I love 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 you.
What we'll do without her.
I love you so much. I'm sorry. I just want to make it better. I just want to make it better. I'm sorry. I'm so sorry. There's nothing that I can do. You just want to tell me to throw it up. I just love you so much. I love you so much.
She would be like anyhow. Just a vegetable sitting in a chair. Yeah. And then put her in a nursing home. And I know that she will never want to go in.
I love you so much. I don't want to give up ever. I would never. Look at your beautiful hair. Look at how her hair is braided. Who did that?
The nurse.
She's so beautiful. She's just so beautiful. I can never give up on you. Never. I love you. I love you so much. You've done everything for us. You so really so much. So many things to make it possible. Things I like. I'm so sorry. I'm so sorry. I was there. I'm so sorry. I'm so sorry. I'm gonna do everything I need to do. I love you so much. I love you so much.
She just couldn't believe it. She says, Carol had so many worries. That's what did all this.
What kind of medication is she on right now? What medication are they putting her on?
I don't know.
We'd have to ask
How
the
do you
nurse.
know?
We'd have to. Do you know what medication
She's there.
on right now?
I can feel her.
Not a lot of them.
Yeah.
Tell me about it.
Alice, this is
She's
Dr.
No, I'm a nurse, Dr. Evans.
Nurse. Oh, you're the nurse.
No. She's on 3 different medicines to bring her blood pressure up right now.
Right.
Without them, she is at dangerously low levels.
Yep.
She's on a little bit of pain medicine that we started this morning just to make her a little bit more comfortable while she was on the vent. But without this medicine, we wouldn't be here right now. So,
Because her blood pressure would drop too much.
yeah, because of the swelling we have going on in our head from the bleeding.
Is there anything you're doing to reduce the swelling?
There's nothing we can do.
Why not?
I am not gonna. There's a lot going on. I'm gonna grab our physician.
Please do.
Okay.
I just
This
want
is
to
her
say-
dog.
No, I know who this is.
And
Okay.
I was trained by this nurse, okay?
No.
She wants me to understand
She wants to make
everything.
No, that's absolutely fine.
That's how I was
Yes.
taught, right? Right, Mom? Yeah, that's right. She makes sure I know what's up. That's right. That's right.
Yeah, you called her a lot about, what do I do about this? This hurts.
She
Or,
told me every day in my life how good her is. Why doesn't she have socks on?
Valerie.
I'm sorry, but I love my
They-
mom.
You can cover her feet up a
They
little bit.
cover her feet up,
They,
and I can
you
ask
can
for
cover,
socks.
you can cover them up, no. They want her, they can't,
I can't put socks on.
honey, they go by color of her skin to tell what,
Oh.
what she's
Oh, okay.
Don't do that. See, you can touch them if you
I can
want
touch
to.
them. I'm gonna warm them up.
Be careful though.
She's
'cause
there though. I know you're there. I hear you. I know you can hear me. Yes, I know you're there. I love you.
It's just, I don't know, something to do with this always.
I love you so
It has some
much.
information and influence.
You've done everything for us, and God, I wish I would have done better. I'm gonna do everything I can. I just don't want to lose you. I love you so much.
She would have probably headed home if she had, at her house. Or could have been in the car on the way
These
home.
are chilly. I want them. It's so chilly. Yeah. I wish I was there. I'm so sorry. I feel your thoughts.
Do you want me to check on Noah?
Yeah, I can if you want.
Okay. I thought I'd wait for the physician to see what was going on.
These are so chilly.
But I'll let you do that.
Yeah, I think you should wait. Michael will take him. He'll get down there and color and all that kind of stuff. But then they got
That's
like
fine.
this stuff.
Okay, you think that's fine? No?
Yeah, do it. Yeah.
I just don't want him to
He's
see
really
her.
adopted.
The doctor said he didn't. I had children and she let him see her. And
My mom made me, right? And I've seen so many people. Yeah, I think it's important. I don't think she would say, don't let me see you. No, she would want to have a moment with him. Yeah, I know that, don't I? Yes, I do. Yeah, it's okay.
as soon as they take all this stuff off, she will. And be serious. Her temperature's going up and down. 87. Going crazy. Maybe she's feeling something.
What is she? I don't know. Just there. I love you. I love you so much.
It was a tough drive getting over to Valley.
No, it was
I just thought maybe we had a lot of get work cars behind any car. Fly down through there, up through here.
Yeah. No, I went fast. But
I'm trying to do make it better.
Yeah, we were called twice. People were calling you.
I love you so much.
What do you think?
I'm so sorry. I wish I
Prepare the
was
staff and stuff.
baby by myself.
yeah.
Some of the staff were sleeping.
Like, that I'm so something. And I just do so much better, and I know it. I'm so sorry. I love you. You've done everything for us. All we could do is look around and see everything you've done for us. If it wasn't for you, what would we have? You're so true. I love you so much.
I know she'd say don't spend the money. Don't spend that kind of money.
I'm gonna take it with me to catch her, okay? Yeah. But it's okay, the kids are okay. Turtle's okay. They're gonna use me. I'm gonna do everything I'm gonna do. You know that's the most important thing. You told me everything. I know you're there.
Oh yeah. I really would like to get him in a special school of some kind. I mean,
Yeah, I was supposed to finish the peer work because I already got admitted to some places.
oh,
Mm-hmm.
schools, different schools.
Yeah, for the next season.
In Belgrade?
Yeah.
And Mrs. Bunny's and stuff.
No, he doesn't have any friends.
Oh, I thought he did.
They're all jealous of him because he's more advanced. Yeah,
He
no.
also watches different shows, and so they.
No,
games and
that's
stuff.
little stuff they'll play you.
I'm sorry, we had a training for him for that was Sean's. It was beautiful. I remember we used to set it up every Christmas.
Yeah.
When I asked her, she said, well, they couldn't do it now because they'd have to do it pre-change stuff in the basement.
It would take a lot of it. Yeah.
So you can still have it if you want to put it at your house.
Hello, are you the doctor?
Hi.
Physician?
Yes.
Physician's here.
This is Alex.
This
He's
is-
her fiance.
Oh,
Her
okay.
daughter, Valerie.
Hey, Mallory. Hey, sorry to meet you like this. Yeah. Unfortunately, in a very tough situation. Do you want to chat here? Do you want to chat in the room outside?
I think the room would be better for us.
Okay, whatever you like.
In which room? This room or that?
That one down there. You took-
Well, yeah.
We can
I
chat.
don't want to leave my mom, but
I don't think she wants to leave her.
Oh, okay. All right. Then we can chat.
I
here.
think it's fine. She worked as a nurse in intensive care
Right.
for countless years, so.
Okay.
So people who in these sorts of scenarios so many times.
Yeah, she's taking care of so many people. Quite large.
Is it?
And it's really affected the rest of her brain.
Okay.
I know her pupils are not responding. All these reflexes that we're checking, she doesn't have. She has only one reflex that's left, which is all the way from the bottom of her brain. So everything else is really quite deadly. We can always keep people artificially alive with tubes and drips.
Is
But
there any way for her to replenish, like, in some way?
no, it's really that bleed is almost like an explosion.
Is it?
Yeah. And so, we can always keep people alive in a vegetative state, meaning somebody in a coma that will look exactly like this for the rest of her life. But most people don't like that
Yeah.
type of outcome.
The other option was to try to drain the blood out, but would the brain recover?
No,
Why not? Can you explain that to me?
Yeah. Maybe we can show you the image as well.
I would
Be able
really
to pull up
appreciate
the
Sure,
CT,
pull it up.
just to show how massive that bleeding is. It's so large that, we can put in the, it's
Getting,
really the amount of blood.
like, how would that
So was it a
hurt?
major
Like,
hemorrhage then?
What's that?
Was it like a major hemorrhage?
A massive hemorrhage.
Massive
yeah.
hemorrhage?
Yeah.
From like a
what type
blood
of stuff
clot or
causes
something?
that?
An aneurysm.
Yeah.
Yeah. Sorry, you were saying?
Oh, so it wasn't like a blood clot, it was an aneurysm
There's
then?
an aneurysm that bursts.
Okay.
And it's so massive, the rest of her brain looks very dusky, meaning it doesn't look healthy.
Look at me.
Well, it's probably just a bed adjusting for her.
This is the blood pressure pump going off over there.
Oh, okay.
But then
I got
they
you.
called me and told me that John, we gotta come to Hawaii, retired in
I
Hawaii.
see.
They said they found her brother had fell in the bathroom. It looked like he either was going to the bathroom or was getting, ready for
I
a
see.
shower.
Uh-huh.
And by the time they found him was the next day that the apartment complex uses paid, so he does special cleaning jobs. And he had an appointment, and that's who found him. And he stayed there that whole day, laying on the floor after he fell.
I see.
So he said,
Thank you so much for everything
Yeah, so if two family members have it, then Mallory, you should also get yourself tested as well. Does she smoke?
no, we don't.
Carol did though.
No, Carol.
Carol did, yeah, she'd probably go through what do you think, Val, maybe a pack?
No, she really cut down a lot. She was getting like.
She did,
So you get it first So as we go through, we're looking at slices like this, coming from one end to the other. So this is her ear, And this is the start of the brain, as you see. This is the front of the face, this is the back of the head.
Yeah.
And then as we go, all this brain looks, you can see all this darkness here, that's not healthy. This bleeding is the start of the bleeding that you're seeing. This is her ear canal that we're going through. And as we go, you can start seeing how big that bleeding is.
Yeah.
Sorry.
What causes that?
Is that
Well, what happened?
all of this?
Like, why was that
all of
happening?
this.
Just like the,
Just a thin blood
That's
vessel?
blood?
A thin artery?
is that blood?
This is all, all of this is blood. You can see how all of this is blood. The rest of the brain is very dark. It does not look healthy.
I think it's before was what you're saying.
That's right. Yeah, there's so much pressure in the brain from this massive amount of bleeding.
So you can't alleviate that.
No, so the tube won't be able to do anything. Surgery won't be able to do anything. It's an aneurysm that bursts into this, and so fixing that aneurysm still leaves the rest of the brain completely damaged.
Yeah.
So that's what she's dealing with.
And what part of the brain is that coming on?
This is the middle of the brain. And so the pressure is so intense that it shut down the rest of the brain. The only reflex that she has left is really coming from way in the bottom of her brain, from here. There's one reflex that's okay, but all of this is dead. And the rest of it, this is what allows her to wake up, this is what gives her her personality. All of that is completely damaged.
It's not something she can recover over time.
This is not something she can recover.
And would it produce like a symptom, like I got a headache?
So maybe not. And so when aneurysms burst,
Oh,
they just explode, and the blood gushes in, and then you're knocked out immediately. And so it's not something. Sometimes people have like a lingering headache, maybe for a day or so. When the aneurysm has a little tear in it, a little bit of blood comes out, and so they have headaches, and then it'll burst open and they will collapse. And so in her case, she was unfortunately by herself at that point, and so it still unfortunately doesn't change. Yeah. But this happened really fast.
So she was packing in the bags to go home to this cabin. My friend said they were just coming back from their trip, and it
That's
looked like
right.
she was packing up to leave to come home.
That's right.
It was maybe somewhere within an hour that they found it.
And it's very possible.
Yeah.
I mean, they called at 2 o'clock, she didn't answer, and they came in at 4 o'clock and found her on.
Oh, I thought
Yeah,
she
That's
answered. I
what
thought she answered it too.
like when I should have.
She answered at 10 o'clock or so, and she was speaking normally in the morning.
Okay.
They
Yeah.
called again at about 2 o'clock.
She was
There
dying,
wasn't-
like, I had all these text messages from her before. She's been fine, and then.
So that means this happened quite instantly, so that means she wasn't really suffering leading up to this.
Is she suffering right now?
It's hard to say. I think her brain is just shut down except for that one tiny reflex that she has left.
Yeah, she has to hear me, I think so.
So when you're with her, if you're holding her hand and things, you might see some random reflexes that comes from the spine.
Yeah.
And so just keep that in mind that these are reflexes from the spine. So it would be hard to say, hey, I held her hand and she squeezed it.
Yeah.
Because she knows that I'm here. But that's a reflex, unfortunately. Yeah. Like when you have infants and you put your finger in their palm, they squeeze.
Yeah.
So it'll be the same.
Yeah. Yeah, the rest of her cells are still operating. It's just the brain that helps keep everything together that's not operating anymore.
Her blood pressure was wildly fluctuating about an hour or so ago. And so that tells me that her body is shutting down.
Oh,
So I
okay.
want you guys to be mentally prepared.
Okay. And the rest of her organs aren't getting what they need signals from her brain, so they're starting to dysfunction,
That's right.
malfunction. Okay.
And then once that you do unplug all the things, what happens then it just, she just goes to sleep.
I don't want to watch it.
So there'll be another team that will come and chat with you about end of life as well. But generally, what we do is, you know, when you guys decide as a family that this is not how she wants to be, if she doesn't want to be in a nursing home, in a feeding tube, unable to talk, unable to care for herself, then if she would rather pass away than be stuck like that, then we would start her on a pain medication, like morphine or fentanyl, so she's not struggling, and then we will take out that breathing tube, and she'll probably pass away in a minutes to a few hours. Everybody's different as to how long they last when the breathing tube comes out. You know, one should be prepared a timeline of seconds all the way to a few days. But looking at her, it tells me hours, minutes to maybe a few hours at most.
When that happens, do their bodies react? Is she going to be moving around when you take that out, or is she just going to be laying there, basically?
So sometimes people are a little uncomfortable, you know, as we increase that pain medicine.
Oh, okay.
You'll see some random movement of the arms and legs.
A little bit of movement. Okay.
I
Does that,
want her to be comfortable,
does
I
that-
want her to be.
I'm just curious in case we bring my son in or anything like that.
We talked about
What do you
that a
like
little bit,
experience?
and,
I mean, for some moments, I think you should be able to see your personals.
How old is?
He's 8.
Okay.
And
So-
I was raised, and I've experienced this, so, like, I mean, she was there every day of his life, so I just think it's important.
Yeah, that's important. So after we take out that breathing tube, you know, she will look calm. It'll probably take about just a few 5-10 minutes or so to make sure she's calm. But at that point, you know, the scene would be very calm. There'll be no alarms going off, no medications other than the pain medicine. And she'll be covered for the most part with a blanket. She will look quite calm as she passes away.
I just want to be comfortable.
Okay.
they know
Absolutely. Yeah.
that we're go there.
Would you want a chaplain?
Yes. Thank you.
There was
We have
one,
the
I
nomination.
think there was one in the hallway there earlier.
I'll call John.
Okay.
John's up here today.
Thank you.
Thank you.
Thank you.
Sorry, I wish I had better news for you, you know.
I appreciate everything you're doing. Thank you so much.
As terrible as this is, I'm glad that she's not continuing to suffer.
Right.
I'm glad we were able to be here.
Yeah. Bless you. Yeah. That's for sure.
What other questions do you have?
Yeah, I know.
I think that, the other thing that I would be asking about is when you pull all the gear off of her face, then if Noah came in, would she have that gone too?
Would she have?
I'm not gonna have it for the last moments or anything. I just wanted him to see her before. Have some moments with her.
Like the way she is now?
Yeah.
The way she is now?
So he can touch her and see her and yeah.
Because you think it might be kind of hectic for her?
Like,
you
I
want-
think it's okay.
Do you want him to be here now and then? Or not when?
But I was raised by this woman and